Thank you, Sipla, for giving me this opportunity. I am Dr. Shyam Shankar Varma, consultant nephrologist from Jubilee Mission Medical College in Thrissur. And this is a patient educational video regarding edema. As you know, 60% of our body is filled with water. What is edema? It is nothing but swelling. There is excess of water in the body. That is, fluid is trapped in some of the tissues of the body. The spaces that surround the body's tissues and organs are filled with, when they're filled with water, you call it edema. You can see the normal appearing leg and the edematous leg on the right side. This edema can occur nearly anywhere in the body. And when it occurs everywhere in the body, it is called as generalized edema or anasarca. Having generalized edema, you can see edema around the eyelids, the face, the legs, the hands, all are edematous and shiny. When it happens in the lower limb, it is called as peripheral edema. And you can see the edematous lower limb where when you press a finger, it forms a pit. That is why it is also called as a pitting edema. When it happens around the abdomen, it is called as ascites. This happens most commonly in liver disease. And in the chest, when it is called as pulmonary edema, where you find fluid inside the air spaces of the lungs. And these patients present with shortness of breath. And it is called as pleural effusion if it is in the space surrounding the lungs. And what are the symptoms? Symptoms depend on the site of edema and the cause of the disease. Usually, most of the patients present with swelling or puffiness of the face. Like you can see the girl in the picture here. And most of them have stretched and shiny skin. And the symptoms are worse in the dependent areas of the body. That is, those that are closest to the ground because of gravity have maximum swelling. Now, where does it appear? It happens in the lower limbs in a patient who is ambulant, who is walking about, standing, sitting, and it happens towards the end of the day. Here you can see the edematous lower limb in a patient who is ambulant. And what happens if the patient is bedridden? It usually happens in the lower back, also known as sacral edema. And in a patient who is lying down, most of the time in the early morning, especially in patients with renal disease, they will have facial edema, periorbital puffiness around the eyelids. This is a patient with a sacral edema. And what are the other signs? Like I told you, pitting, it forms a pit. When you press on the swollen skin for a few seconds, it will leave a temporary dimple or a dent in the skin. And these patients, most of them have weight gain because of the excess fluid, increase in the size of the abdomen as it happens in ascites, and difficulty in breathing if the air spaces are filled with fluid. And what are the common conditions associated with edema? In kidney disease, most common is the kidney disease, where you have swelling in the lower legs, around the eyes, and shortness of breath. That is, fluids can accumulate in the tissues as well as in the lungs, abdomen, everywhere. And the two common conditions associated with edema are, one is nephrotic syndrome, where you have excess of protein leakage in the urine. As you know, nephrons are the filtering units of the kidney. And once the proteins are leaking through the urine, you find a lot of patients with edema because of low albumin levels. And in chronic kidney disease, when the kidneys don't function well and don't excrete enough water, you have fluid retention and edema. And in heart failure, what happens, also called as congestive cardiac failure, the heart doesn't pump enough, and the weakened heart, impaired pumping action causes fluid accumulation in the lungs. This is also known as, like I told you earlier, pulmonary edema, where fluid fills the air spaces of the lungs. And these patients present with shortness of breath. What are the other causes? The other causes are less common: chronic venous disease because of poor competence of the veins. Like you have heard of varicose veins. Varicose veins can cause edema. And when there is clot in the deep veins of the lungs, also known as deep vein thrombosis, especially in patients who are immobilized for a long duration, they can have deep vein thrombosis, and that can result in asymmetrical lower limb edema. Pregnant people retain a lot of fluid, and they can have edema as a physiological edema of pregnancy. And edema can occur as an adverse effect of a variety of medications, most commonly being antihypertensive. high blood pressure medications like calcium channel blockers, nifedipine, and other calcium channel blockers. And oral diabetic medications, most common among them will be pioglitazone. And over-the-counter pain relievers, also known as NSAIDs, non-steroidal anti-inflammatory drugs like diclofenac and ibuprofen, and some of the female hormone supplements and estrogens, and the oral contraceptive pills. All these can produce edema as an adverse effect. Like I showed you, the patient with ascites, the patient with swelling on the abdomen, cirrhosis is a common condition. Chronic liver disease can cause edema. Hypothyroidism, if untreated for a long time, can produce generalized edema. And edema can occur as a result of allergic reactions to several medications. This is known as angioedema. And whenever there's a lymphatic obstruction to the lymphatic drainage of the lower limbs, the legs, it can result in lymphedema, like you see in filariasis. And patients who are traveling for prolonged periods of time, such as during air travel, you travel from India to US, you stay in one place in an economy seat for nearly 24 hours, you can develop what is known as a deep vein thrombosis, and that can result in edema. And how do you commonly treat edema? Common treatment for edema is treatment of the underlying cause. If it is cirrhosis, treat the cirrhosis. Kidney disease, treat the kidney disease. Congestive heart failure, because heart disease, you treat the heart disease. So treatment of the underlying cause, identifying the cause and treating is of utmost importance. Next, most important thing is salt. Salt is a very important factor. You have to reduce the amount of salt in your diet if you have edema. And some of the other less common things that you can do are, one is compression stockings, where you can reduce the lower limb edema by tight stockings that can increase that can avoid the venous incompetence. And of course, elevating the legs. When you elevate the legs, because of the gravitational drainage, most of the fluid comes back into the upper part of the body. And the most important treatment is, of course, diuretics. These are medications that can cause the kidneys to excrete more water and more sodium. Any substance that promotes diuresis, any substance that helps in loss of edema by patient passes a lot of urine, any substance that promotes diuresis is called as a diuretic. That is increased production of urine. Sometimes it is colloquially called as a water pill. Sometimes a weight loss pill. Some people use it as a weight loss pill. These diuretics help in edema because of a fluid overload state. Fluid overload related edema is treated by diuretics. Fluid overload because of heart disease, kidney disease, liver disease, all these can be treated with diuretics. These diuretics are not without adverse effects, so it has to be prescribed only by a registered medical practitioner. You have peeing more than usual. You pass a lot of urine when you give a patient a diuretic, and that can result in extreme fluid losses, causing dizziness, tiredness, headache. And of course, low potassium. Unless you're taking a potassium-sparing kind of diuretic, low potassium is an important adverse effect of a diuretic that can cause severe muscle pain and difficulty in getting up from the squatting position and sitting position, tiredness. All these can be as a result of muscle weakness. All this can be as a result of low potassium. Muscle cramps is a very important and common adverse effect. The most common among the diuretics are loop diuretics. Loop diuretics, you can see, these are used to treat fluid retention, that is swelling that is caused by congestive cardiac failure, liver failure, or kidney disease. You treat with loop diuretics because they are the most potent among the diuretics. And some of the examples of loop diuretics are, the most potent is torsemide, and other one that is more commonly used is the furosemide, also commonly called as Lasix. The take-home message is, for all people out there listening to the video, edema is swelling, mostly indicative of fluid overload. And the life-threatening causes are when it affects the kidneys, heart, and the liver. The treatment, the mainstay of treatment is salt and water restriction. Medication that is used to treat is called as a diuretic. Thank you for giving me this opportunity. That's all in this short video.